In the delicate balance of health, there's a tiny number that holds immense power: your blood glucose level. Welcome to a world where numbers speak volumes, where every fluctuation tells a story of wellness and vitality. Today, we embark on a journey into the realm of monitoring blood glucose levels, where precision meets empowerment, and every reading paints a picture of your well-being. Join us as we unravel the importance of this vital metric and discover the tools that put control back in your hands. Number 1. Vital Health Indicator refers to a measurement or parameter that serves as a fundamental marker of an individual's health status. In the context of blood glucose levels, it plays a pivotal role in assessing metabolic health, particularly in individuals with diabetes. Blood glucose levels fluctuate throughout the day in response to various factors such as food intake, physical activity, stress, and medication. However, in individuals with type 1 diabetes, these fluctuations can become more pronounced and challenging to manage due to the absence of insulin production. People with type 1 diabetes often use a combination of methods to monitor their blood glucose levels. This may include traditional finger stick tests using a glucometer, continuous glucose monitoring systems, or newer technologies that provide real-time glucose readings. These target ranges typically aim to keep blood glucose levels within a relatively stable range to minimize the risk of both short-term and long-term complications. With the help of regular blood glucose monitoring, patients can adjust their insulin therapy to match their body's needs. This may involve administering rapid-acting insulin before meals to prevent blood glucose spikes or adjusting basal insulin doses to maintain stable levels throughout the day and night. Continuous monitoring of blood glucose levels allows individuals to identify trends and patterns over time. Monitoring blood glucose levels enables people to detect and address fluctuations early, reducing the risk of high blood sugar or low blood sugar episodes. Prompt intervention, such as adjusting insulin doses, consuming carbohydrates to raise low blood sugar, or seeking medical assistance when necessary, helps maintain glycemic control and minimize the impact on overall health. Blood glucose levels serve as a vital health indicator for patients with type 1 diabetes, providing valuable insights into their metabolic status and guiding personalized treatment strategies. Through regular monitoring and proactive management, individuals can strive to maintain optimal blood glucose control, thereby reducing the risk of complications and improving their quality of life. Number 2. Prevention and management. Preventing complications associated with type 1 diabetes involves maintaining blood glucose levels within a target range to reduce the risk of long-term health issues. T1D is an autoimmune condition where the body's immune system mistakenly attacks the insulin-producing cells in the pancreas. As a result, patients with type 1 diabetes require insulin therapy to regulate their blood glucose levels. Effective management of blood glucose levels through insulin therapy, diet, exercise, and regular monitoring plays a crucial role in preventing complications associated with T1D, such as cardiovascular disease, kidney damage, nerve damage, and eye problems. Consistently high blood glucose levels can lead to long-term complications, while severe episodes of low blood glucose levels can result in immediate health crises, emphasizing the importance of vigilant monitoring and management. Insulin therapy is the cornerstone of treatment for T1D. It involves administering insulin either through multiple daily injections or an insulin pump to mimic the natural release of insulin by the pancreas. Different types of insulin, including rapid-acting, short-acting, intermediate-acting, and long-acting insulin, may be used in combination to achieve optimal blood glucose control throughout the day and night. A balanced diet that includes complex carbohydrates, lean proteins, healthy fats, and fiber is essential for managing blood glucose levels in people with type 1 diabetes. Monitoring carbohydrate intake and matching it with appropriate insulin doses helps prevent post-meal spikes in blood glucose levels. Consistency in meal timing and portion sizes, along with regular monitoring of blood glucose levels, enables patients to adjust their insulin doses and dietary choices accordingly. Exercise has numerous benefits for patients with T1D, including improved insulin sensitivity, better blood glucose control, weight management, and cardiovascular health. Engaging in both aerobic exercises such as walking, swimming, or cycling and resistance training such as weightlifting helps regulate blood glucose levels and promotes overall well-being. Prevention and management of blood glucose levels in patients with type 1 diabetes require a comprehensive approach that encompasses insulin therapy, diet and nutrition, and physical activity. If you're finding value in this content, don't forget to show your support by tapping that like button below. Your feedback keeps us going. Now, let's dive right back in and continue our exploration together. Number 3. Personalized treatment for type 1 diabetes. This involves tailoring medical management plans to the patient's unique physiological and lifestyle factors. This approach recognizes that people with diabetes are exactly alike and that treatment needs to be customized to address their specific requirements effectively. It is characterized by the body's inability to produce insulin, the hormone responsible for regulating blood glucose levels. Therefore, insulin therapy is the cornerstone of treatment. However, the dosage and delivery method of insulin can vary significantly from one patient to another. Personalized treatment involves working closely with healthcare providers to determine the most appropriate type of insulin and the optimal dosage regimen based on factors like insulin sensitivity, activity level, and meal patterns. Personalized treatment includes education on carbohydrate counting and meal planning to help individuals manage their blood glucose levels effectively. While general guidelines exist for carbohydrate intake, personalized approaches take into account factors such as glycemic index, insulin to carbohydrate ratios, and patients' response to different foods. Registered dietitians work with patients to develop meal plans that suit their preferences, cultural background, and lifestyle while maintaining glycemic control. Living with type 1 diabetes can be emotionally challenging, and personalized treatment recognizes the importance of addressing psychosocial factors and mental health concerns. Healthcare providers may recommend counseling, support groups, or resources to help patients cope with stress, anxiety, depression, or diabetes-related burnout. By addressing the emotional aspects of living with a chronic condition, personalized treatment aims to improve overall well-being and treatment adherence. Number 4. Empowerment and control. These are essential components of managing type 1 diabetes, where individuals take an active role in monitoring their blood glucose levels and making informed decisions about their lifestyle choices. Empowerment begins with self-awareness. Don't forget to like, share, and subscribe to our channel for more valuable insights on managing diabetes and living a healthy, fulfilling life. Together, we can empower each other to thrive with diabetes. See you next time.